Okay, good morning dear students. Today we're going to learn about the MCQS video for the S2. This is the 6th video. Here we go. The first question: which of the following structure does not pass through the foramen magnum? That is the accessory pharyngeal artery. And here we can see that we got here from another foramina going upward, but not from the foramen magnum. Rest of the structures are passing through the foramen magnum. So next we got here question number 2: which of the following nerve does not pass through the jugular foramen? In the previous video this question also came here today again. That is the hypoglossal, because it got its own canal. We call that hypoglossal canal. Which is the thickest boundary of the orbit? And that is the lateral boundary. Let's have a look here that we can see the lateral boundary is the thickest, because the superior, medial and inferior is not as thick as the lateral. Which bone is not a bone within the bone in the petrous part of temporal bone? So we can see here the three are the middle ear bones, but the hide is exception, so that we got here the hide bone. Which of the parasympathetic ganglia does not have a secretomotor root? So let's have a look here. The answer is the ciliary, but why? Because the parasympathetic root is the motor for the ciliary ganglion. Rest of the other three ganglion are going to the glands, but this one is going to the muscles only, so it is the only motor. Nasolacrimal duct open into the anterior part of the inferior meatus. How? As we can see over here. Dangerous area of face is named because of connection of the cavernous sinus with the facial vein through. Surely it is connecting with the help of the deep facial vein, as we can see from here. The connection of the deep facial vein with the cavernous sinus. Which of the following muscles separates the orbital and the palpebral part of the lacrimal gland? We got here levator palpebrae superioris. Gland is present superiorly, so that is also. So let's have a look here. When we see that lacrimal gland, then we see that here the tendon of levator palpebrae superioris is dividing into two parts. Infection in dangerous area of face usually lead to the cavernous sinus thrombosis, as we see that the relationship over there. Supraorbital artery is a branch of, and look at that, the supraorbitally that we got here, the ophthalmic. So here we got the supraorbital artery, and we can see that is coming from the ophthalmic artery. So up to here, see you guys in the next video. Thank you very much.